Today's topic is sleep issues with Parkinson's. So sleep issues and Parkinson's, well, I suppose I've discussed this before, but when I carried out the survey, it was only then did I realize that sleep issues is actually the top issue experienced by anybody who answered the survey. So 70% of people have issues with sleep, insomnia being the number one issue. So I suppose poor sleep, we all know how it can affect you, but according to research, 90% of people with Parkinson's actually have issues with sleep. It in turn then, so sleep deprivation can exacerbate Parkinson's symptoms. It can lower your immune system over a long period of time if it's chronic sleep deprivation. You can have physical symptoms from lack of sleep. And you can also have psychological symptoms. And by those, I mean your anxiety levels can increase. You can be lethargic and fatigued throughout the day. Cognitively, you may not be as sharp if you are suffering from sleep deprivation. And sleep deprivation is insufficient sleep or sleeplessness. And it's a condition of not having an adequate duration of sleep or a poor quality of sleep to allow you to perform physically and psychologically, and for your benefit of your health. It can be acute, it can be chronic, just like with anything, and it can vary from person to person, but it can be very debilitating and very frustrating for those who do suffer from it. So causes of sleep deprivation for people with Parkinson's. Usually it's related to, I suppose, it can be related to dopamine insufficiency or decreasing dopamine levels at nighttime. But the symptoms that people with Parkinson's usually experience vary greatly. However, these are just some of them. So insomnia, where you don't get to sleep, you've trouble getting to sleep or trouble staying to sleep. So that'll obviously have an impact on the following day. If you have off symptoms, so some people may have cramps or dystonia or difficulty turning in the bed at night or rigidity, and that would obviously prevent sleep. Nocturia then can be an off symptom as well. So when the level of your medication is wearing off through the night, you may experience this nocturia, which is just a frequency of needing to use the bathroom or urination at nighttime. For some people, it might be once a night or twice a night. For others, it could be 6 or 7 times a night. So like I discussed last week in the bladder issues, I'll just go through nocturia shortly and tips, I suppose, to try and deal with it. Some people with Parkinson's suffer from very vivid dreams and very vivid nightmares and frightening nightmares. So that will prevent them, and I suppose, from going asleep or waking them frequently. A lot of people mightn't want to go to sleep at all because the nightmares are so severe. Restless leg syndrome then is something that a lot of people with Parkinson's experience. And this is more initially the beginning of the night. So usually at the start of the night. And I'll discuss it in more detail shortly. Anxiety can stop people obviously getting off to sleep, where your mind just won't switch off. And sleep apnea. So sleep apnea is where there's an interruption in your breathing cycle through the night and you wake. It may be unbeknownst to you, but you actually wake quite frequently because you pause for your breaths. So the off symptoms, like I just explained there, it's when the medication that you take is wearing off through the night. So some people will be on medication 3 or 4 times a day. The last tablet might be 7 o'clock at night. For other people, they may have a slow release tablet at nighttime, so that will be taken just before going to sleep, and that may carry people through the night. Sometimes it's not enough. There are people with Parkinson's that may require your medication through the night. So I've spoken to people that would even wake at 2 or 3 o'clock in the middle of the night to take more medication. And then they can return back to sleep quite well. Wearing off, as you know, it may be symptoms of stiffness, slow movement, difficulty turning, and pain. And the slow movement and difficulty turning and stiffness will all impact on the ability to get out of bed then, if you did need to get out of bed to go to the bathroom or that. With regards to pain, so it's closely linked with all symptoms for some people. Some people may have a historical pain anyway, but for those with Parkinson's, it may be linked to the wearing off of your medication. Those pain symptoms that are experienced might be dystonia, which is a spasm-like pain. It can be in the neck and the shoulders, or it can be in the feet. For example, burning sensation. So a lot of people with Parkinson's experience this burning sensation in their lower limbs usually, and then cramping of the legs. And that can be wearing off of the medication, or sometimes it can actually be when there's too much of the medication. So it's just important, I suppose, if you do experience pain, that you keep a little bit of a diary, and then you can ring me and we can discuss and try and figure out what may be causing it, or when it's at its highest intensity. So some medications then that may help, I suppose, with off symptoms. So like I mentioned, a slow release tablet, a CR, which is a controlled release tablet overnight. Sometimes dopamine agonists are used and are quite beneficial for night periods. They can be a slow release as well. Some people may require analgesia, so that's painkillers of some form. Quinine is also something that's recommended for leg cramps. There is a suggestion that even tonic water, which has quinine in it, is beneficial for the leg cramps, although it's a very small amount of quinine. And then some people may require the bed rails or bars to help with turning, or the slippery bed clothing, which is kind of a hard thing because I can't imagine it being that comfortable, especially on warmer nights. But it's just to allow ease of movement, I suppose, and less friction. So restless legs, and I've covered this in a few talks before, so within the pain issues and sleep issues, because it's usually an issue that people experience at nighttime. It can be during the day as well, but mostly at nighttime. And I suppose if the nerve cells in the brain are damaged and the amount of dopamine is reduced, it can cause involuntary movements and spasm-like movement. Restless legs is actually more common in women than it is in men for whatever reason. And some of the symptoms then of restless legs, if you haven't experienced it, it's a discomfort, it's a pain. It can be a tingling sensation or a burning sensation in the legs. It can be a throbbing, and it's really an urge to move. So your legs are restless, so you constantly need to move them. Sometimes when you do move around, it helps, but not always. Some causes of the restless leg syndrome then. So although I would say sometimes medication helps, sometimes actually medication can hinder, and it can cause restless leg syndrome. So high levels of levodopa sometimes cause it. Dopamine agonists, as I said, they may be used to help, but they may also increase the chances of it or increase the severity of it. Low iron is also something that is known to cause restless leg syndrome, or it may be idiopathic. Idiopathic means there's no known cause for it, and some people may have had restless legs 20 years before they're even diagnosed with Parkinson's. So we can't always blame the Parkinson's, because some people do have it prior. Some treatments then and suggestions other than the medication of agonists would be massage. People find massage very beneficial. Hot or cold compresses, so it just depends which works for you. Some people feel the benefit from the hot compress or the cold. Light clothing and light covering. So a very heavy duvet can cause, I suppose, the restless leg syndrome to worsen, and the sensation to worsen. Diet may also be beneficial if you just assess your diet and make sure that you have your balanced diet, of course, but with your vitamin Bs or with increased iron in your diet, and of course then medications. So your agonists, as I said, or you may need, if your iron is low, you may need iron supplements. It's not an easy one because it's quite hard to, I suppose, treat, but it can be very difficult for people to live with and deal with the restless legs at night time, because it's quite hard to control it. So nocturia, and I covered it last week, it's where you have a frequency of urination at nighttime specifically. So it's an increased frequency and increased urgency at nighttime. As I said, it may be related to wearing off of your medication, but for the men, it may also be prostate related, enlarged prostate or prostate issues that cause it. Women do experience it as well. So it may be Parkinson's medication, or as I said, it may be habit. That when you wake during the night, so if you are having sleep issues and you are waking during the night, you think, right, well, I'll get up and go to the bathroom anyway because I'm awake. So some things then and suggestions to try and help with this increased frequency at nighttime, because some people who wake to go to the bathroom have a huge difficulty getting back to sleep, or if you're awake 6 times a night, you can imagine the little bit of sleep that you are getting and how interrupted it is. Tips to, I suppose, are to avoid caffeine. The Italians would say no caffeine after lunchtime, but I would say, I suppose, after 3 o'clock or 4 o'clock, depending on the person. Carbonated drinks can also irritate the bladder, so it may cause you to get up more frequently. Alcohol can also cause irritation to the bladder. And I would always say reduce the fluid that you're taking in. So reduce what you are drinking from a certain time. So be it 6 o'clock in the evening or 7 o'clock in the evening, and try to limit the amount that you drink then before bedtime, if possible, but don't restrict it during the day. And then some people may need to assess their environment to make sure that there's either a bathroom nearby, or that there's equipment nearby if they need increased assistance, I suppose. And then, of course, there are medications that can be given and prescribed by your GP or your consultant, be it the neurologist or a consultant urologist, which is the waterworks. And sometimes people do require medications for this issue because it is causing major problems at nighttime. Sleep apnea then. So some people wouldn't be aware, but sleep apnea is actually a very common symptom that people with Parkinson's experience. And what it is, it's a gasp or a pause in snoring. So it's a gasp after a breath, or it's a pause in snoring. And I suppose your sleep is very fragmented then, so it's very broken, with leading to, you may not be aware of it, but you'd have a very poor overall function the following day if your sleep is constantly being broken and paused through the night. And sleep studies is usually the technique that they would use to diagnose sleep apnea, and then it does require treatment. Some people would require a machine, a CPAP machine, which is a positive pressure machine to keep the airway open. Some symptoms of sleep apnea are headaches, dry mouth, that gasping noise, or loud or chronic snoring, increased daytime sleepiness, and then broken sleep through the night. And some people might not be even aware of it, that they have sleep apnea or that they are pausing at night. It's actually the people in the bed beside you that realize it. So there are 3 types, I suppose, or 2 types. There's obstructive sleep apnea, which is the most common experience, and it's the muscle and the tissue. So it's a collapse of the soft tissue and loss of muscle tone. And it can also be due to fat buildup. There's central sleep apnea then, which is more likely those with Parkinson's experience. And that's where the neurons aren't sending the right messages and there's a signal failure. The treatment then for sleep apnea, so it depends on the severity of it. And as I said, it would be through sleep studies usually that you'd be diagnosed with sleep apnea. You can have mild sleep apnea or severe, like all. It may require a change to Parkinson's medication. It may be suggested weight loss if it's due to fat buildup or if it's increased weight. A dental opinion is sometimes suggested as well, because some people do grind their teeth at night as well. And it may be related to the tongue muscle. And some people do need the CPAP machine, which is, I suppose, quite difficult to get used to. It's a machine and it's a mask that blows positive pressure to keep the airways open. And some people tolerate it okay. I haven't spoken to anybody that's really tolerated it and taken to it very quickly. It usually takes a couple of months to get used to it. And I suppose when somebody with is experiencing sleep apnea, it's caused, I suppose, it drops oxygen levels, blood pressure can increase, and heart rate slows down. So that's what leads you to wake up and take that gasp of breath. They're very quick, brief pauses in the breath, but that's why you may not be aware of them. But it is happening, and it is breaking the sleep pattern. So some medications for Parkinson's may interfere with sleep in different ways. Some medications can keep people awake, and they can be stimulants, especially if they're taken in the evening time. So there are certain medications that people would advise you don't take past a certain time. Mirapexin is one of those, or pramipexole. They advise that you take that earlier in the day if possible. Some people would have high dose levodopa, which would be your Sinemet, your Stalevo, or your Madapar, for example. They can also cause insomnia, so people can have difficulty getting to sleep. Amantadine, which is also known as Simetril, or Eldepril, which is Selaginine, they can also cause insomnia. Some people who need diuretics, which are water tablets, so not related to Parkinson's, but maybe related to cardiac issues, they might have you up more frequently at nighttime, so it's advised that you don't take them at night. And then clonidine, which is used for sweating disorders as well, that may also have an impact on your night's sleep. So it's advised that you take them earlier in the day. And if you are started on any of the medications and you notice an effect on your sleep, that you try and keep a diary just so that you can go back to the consultant and say, this is the impact that's having, and this is the sleep that I am getting and the pattern. So back to the diary again. Mid-sleep issues. So a lot of people, and this was in the news recently about research with regards to nightmares and the link with Parkinson's, or REM sleep disorder. So mid-sleep issues will be very common, and sleep talking, so talking in your sleep, reenacting your dreams, lashing out in your sleep or hitting out in your sleep. Parasomnias. So parasomnia is a disorder that's experienced on waking, or when the light sleep changes to the deep sleep, and it's movement more than anything really, I suppose. Sleepwalking is sometimes an issue experienced. It may be neuropsychiatric problems or cognitive decline. So some people will experience worsening mid-sleep symptoms with cognitive decline, or if they have severe anxiety that's untreated, or a form of dementia or Alzheimer's, of course. So just to give you a brief overview, I suppose, of what happens when we're asleep. When we sleep, our brain doesn't, and you're constantly moving from the stages of sleep of REM, which is rapid eye movement, to non-REM sleep. And there are 3 stages of it. So of the non-REM sleep, the 3 stages are transitional stage, stage 1, where you're aware of your surroundings and you would be easily woken. So you're between wake and sleep. Stage 2 then is where the heart rate starts to slow down, your body temperature starts to decrease, and your muscle activity decreases. And this is where your body is getting ready for the deep sleep stage. And stage 3 then is the deep sleep. So your body, this is the stage where your body repairs and regrows. Your respiratory rate, so your breathing rate, your heart rate, and your temperature is at its lowest. And it gives your immune system time to regenerate and strengthen. The REM stage then, so the rapid eye movement stage of sleep, is where we'd all like to be, but you're only in it for a certain period of time. And it's where the brain becomes more active, actually, where you are dreaming, and your dreams can become more vivid, as I said. And as the night goes on, this stage increases. Your brain stops sending signals to the muscles, and it's the sleep atonia. So you completely relax and you go into a state of complete relaxation. But people with Parkinson's experience sleep behavior disorder in this phase. So if it's your deepest stage of sleep, and you're constantly being woken from it, then you can imagine the disturbance that you're having overall through the night. So the rapid eye movement stage is for those with Parkinson's, is where people with Parkinson's can behave unusual or different, where they may have vigorous movements of their arms or legs. They possibly could injure themselves or the person in the bed beside them. They may call out or scream in their sleep. Their dreams will become very vivid, and they may not be nightmares, but they may develop into nightmares. And actually, it's subconsciously. So you may act out a violent dream or a vivid nightmare, and you won't be able to recall it. It's the person in the bed beside you that usually is the one that lets you know about it. I suppose dopamine is needed, and this is where it comes in. So dopamine is actually needed as the paralyzing chemical for sleep. And if this level of dopamine is reduced and depleted, it causes sleep disruption. So psychological issues that can have an impact on your sleep. Well, anxiety, which is obviously excessive stress or excessive worry, and is a much more heightened level for those with Parkinson's. It can cause sleep disruption because you find it very difficult to switch off. It's a time of night where everything's quieter around you, so you have a lot more going around in your head, and it's very hard to put things out of your mind. Depression. Well, depression has symptoms which include insomnia. So it's quite hard to distinguish sometimes, is it just the Parkinson's, or if you are in a more depressed phase, I suppose, or state, it may have an impact on your sleep. And sleep and issues at nighttime can be more common in people with Parkinson's who have depression. So it's just something to be aware of. And then hallucinations at nighttime, so not necessarily when you're asleep, so taken away from the nightmares. Hallucinations at nighttime can be a side effect of medication. It can be due to the progression of the Parkinson's disease, or it may be due to an infection. So it's not always down to Parkinson's. But I've spoken to some people who would have severe hallucinations at night if they go into the bedroom, so they avoid going in, or that their nightmares can be so vivid and so terrifying that they actually don't want to go to sleep. So it is something that's very important to address. And then medications. So people always say, well, sleeping tablets, would they work or are they beneficial? GPs and consultants will always be cautious about prescribing sleeping tablets. Depending on how a person responds to them, you won't know until they try them, I suppose, but it can increase the likeliness of falls. It can cause daytime drowsiness the following day. And I suppose it's a short-term solution, really. Although some people do need them because their insomnia is so bad and their sleep issues and deprivation is at such a level that they need the sleeping tablets or assistance. But they are short-term. And some people feel that if they are prescribed sleeping tablets and then they stop them, that they get this rebound insomnia. So actually the insomnia comes back, but at a much higher level and a much worse state if they have to stop the sleeping tablets. Of course, there's a dependency associated with sleeping tablets. And some people actually build up a tolerance to the sleeping tablets, so they may require a higher dose over a period of time. And as I said, it's a short-term solution. So it doesn't work for that long, but sleeping tablets don't always agree with people. And consultants and GPs are quite cautious in prescribing them. With regard to hypersomnolence, this is daytime sleepiness. So it's excessive daytime sleepiness with a sudden onset, which can be caused by medications. So again, you can experience this when you take dopamine agonists or the levodopa medication. And if somebody was to say that they experienced this to me, I would always ask, can they see a link between when they take the medication and this daytime sleepiness kicking in? So within half an hour of a tablet or within an hour of a tablet, or is there no pattern at all to it? It may be, of course, caused by a poor sleep pattern from the night previous, and that'll have an impact on the following day. And it might obviously have an effect on driving or operating any machinery. But fatigue, I suppose, is a very, very common symptom that people with Parkinson's experience. So it's a very hard one to try and tease out as to what might cause it. But it can be quite disruptive. So sleep hygiene, and we're all great at giving out this advice, as I said to someone the other day, but we don't usually listen to it. You might do it for 1 or 2 nights and see a benefit and then go back to old habits. But it's all about the quantity and quality of sleep. So some people say, well, they get a very good quality of 5 hours, but other people might say they get 8 hours, but it's broken constantly through the night. So it's about the amount of time that you get and whether the quality of it is good. If you got 6 or 7 hours night's sleep unbroken, that would be considered quite good. Your environment is very important. So when you're going to bed, make sure that you have time to wind down, that you avoid or limit screen time, that you avoid watching something that might be a horror movie, for example, on TV or the media. That might increase anxiety and then play through in your dreams. Try and avoid caffeinated, I say limit, but I would avoid caffeinated drinks before bedtime if possible. And if you are consistent with your bedtime, it plays a huge role in your regime and your sleep hygiene and your routine. Routine is very important. So try and be consistent with the time that you go to bed and to go to sleep and at the time that you wake up. And you kind of have to be in one way because you may have to take medication before you go to sleep. And then when you wake up in the morning at a set time, you may have to take medication at 8 o'clock in the morning, for example. Whereas if you wait some mornings and only take it at 10, it's not as beneficial. I'm a huge advocate for a nap. So that's taking a rest earlier in the day for those that need it. I wouldn't say any later than 3 o'clock, and 45 minutes is sufficient usually for most people. No longer than that, because it may have an impact on your nighttime sleep, but it allows you to switch off. The fogginess can disappear, and you reset your whole body. And actually people who I give this advice out to come back to me and say, okay, I didn't think it would work, but actually I'm much better and my evenings have improved significantly. So when I say it, it really does work. And then exercise, of course. So we know that exercise has huge benefits, but it also uses up energy. It gives you, I suppose, fresh air. It increases serotonin, and it's good for the physical body and it's good for the mental body as well. So it's very important. And small amounts of exercise if they have to be, but even a walk or the gym, whatever suits you, but exercise also will help. You'll get a much better night's sleep. Some suggestions then, I suppose, because yes, there are medications, as with everything that you can have for sleep symptoms that you may be experiencing, but other things to try and use before, I suppose, having to reach for more medication. Mindfulness is really, really good. It's really beneficial. It resets the body, it resets the mind, and it kind of makes you focus on just you and just your body. And another thing that I find very good is actually counting backwards from 100. And anytime something comes into my head, I go back to 100 and count backwards again. And with the mindfulness, you're focusing on your breathing. So it really does calm everything down, and it is very, very beneficial. There is a toolkit that the Parkinson's UK website developed during COVID. So it gives you brief videos on mindfulness, the benefits of it, and how to use the toolkit. And then obviously D Daily does mindfulness classes on Zoom, which will be restarting in September then. There are 2 apps, so Calm app, which is more mindfulness and sound effects, and then this Fizz app as well. I use the Calm app actually and find it very good. I haven't used the Fizz app, but its aim is to achieve a higher quality of sleep. So you can use music, or you can use voiceover or sound effects. So whether it's the rainforest or the sea, whatever works better for you. The EPDA, highlight a sleep well week. So they have various articles and suggestions on sleeping well and sleep hygiene. And then a mind guide to Parkinson's disease was a sleep diary. I think it was the Parkinson's Foundation that did that. But it's just highlighting the importance of keeping a sleep diary. If you are someone who experiences sleep issues, keep a diary for even a couple of nights, just so that you can either go to myself or you can go to your GP or your consultant and say, this is my sleep pattern. This is the daily routine and this is the effect of it, which is very beneficial then if you are having symptoms and it needs to be addressed. Thank you.